Welcome back to the Resonant Life podcast. I am your host, Dr. Leila Doolittle, and today I am joined by Dr. Anna Cabeca. I am so excited for this conversation today. Welcome.
I am so glad to be here with you. Me too.
Yes, so I have been a fangirl for a very long time, ever since I got introduced to your Julva cream. I think it is so important for so many reasons, and it's from both a biochemical, physiological standpoint, as well as from the neurological aspects of how important vaginal health is and the pleasure centers of the neurological connection to the vagina. So I would love to just start out just with the foundation of tell me a little bit about how you got into this work and what inspired you to create this Julva cream.
Oh my gosh. So it's a good story. But first of all, like I'm telling you, the vagina is essential for life. Vulvovaginal health is critical for life and enjoyment and the quality of life because things aren't going well down there. Anyone who's ever had a yeast infection or dealt with any incontinence or a vaginal infection of any kind, like life is not good.
Yes.
So paying attention to that is really important. And what I saw as a gynecologist and an obstetrician is that many times, especially as women age, their pelvic health is underaddressed or completely ignored, even to the sense when they're told, oh, you don't even need a pap smear anymore. Well, let me just set the, stage for that. Like for the rest of our lives, we do. And not so frequently, but periodically. And a pelvic exam is always critically important. And we want to keep a healthy pelvic floor. So Leila, in my practice as a gynecologist, one of the things that I addressed was stress incontinence. Urinary incontinence was one area. And I would do vaginal sling procedures. And as I got really good at compounding hormones and recognizing how important it is to prepare the tissue, make it the strongest, healthiest, get good tissue, good muscle. So I'd have an excellent repair and that patient would do great for, without issues of mesh erosion or anything else, any other problems, became really important as I got better and better at it. I mean, I remember one day I did 6 sling procedures, but and I would use hormones pre-op and then post-op, but as I got better and better at compounding hormones and starting them 2 months ahead of time prior to surgery, they'd come back in for the pre-op date for surgery. And they'd be like, Dr. Anna, I ran 5 miles. I've been on the trampoline with my kids. I'm not leaking at all and having the best orgasms. Dr. Anna, and so I recognize, I'm like, okay, first of all, I don't need to operate on you now. Let's just continue a maintenance dose of this combination of like DHEA and sometimes with testosterone. And the patients did amazing. And then, of course, also with sexual health and issues with desire, dryness, orgasm concerns, diminished orgasms, and how we can use bioidenticals, hormones, as well as there's so much more. It takes more than hormones to fix our hormones.
Yes.
I built an entire course called Sexual CPR about this issue of desire and intimacy. So there's a lot to it. But I created Julva specifically because when I retired my practice in 2014 and I'd gone to doing concierge practice and then retired my practice, my patients were like, our doctors won't compound. They're unfamiliar with compounding. Yes. They won't create your creams for us. And I committed to my patients at that time that I would create something over the counter that was better than anything I could write on a prescription pad. And that's how I created Julva. I really worked with my formulation and adding in the plant stem cells, DHEA, and the emollients to really drive those ingredients in to support really reverse aging the vulvovaginal tissue, clitoris to anus, the most important real estate of our body, says your gynecologist. I mean, it's for quality of health. It makes a huge difference in our quality of life. So,
yes. Oh, I love it. Thank you so much for sharing that background behind this. I love the product myself, and I've had hundreds of patients that just rave about it and just constantly restock because they know that it's so important and they can tell the difference just within a few weeks of using it. Well, really just a few days of uses, especially for the pleasure scent and for the vaginal health with moisturizing. that's a huge component that I think we don't talk about from enough angles. Like we oftentimes talk about just using a lubricant as a substitute, but not asking the question of what's the root cause for why there's vaginal dryness and why there's discomfort. Like painful sex is not a normal thing, or it's a typical thing that many people have, but it's not normal. And even if it's common, it's just because so few people are doing the things to get to the bottom, to get to the root cause of that. So let's go into that a little bit more about how important it is for the glands of the vagina and for like helping to actually resolve what was the issue in the first place. That's so important to think about those angles.
Yeah, well, I think it's important to understand the physiology as our body's shifting. As we start to lose, DHEA is a pro-androgenic hormone, helps us produce testosterone and estrogen. Well, it peaks in our 20s and then starts to decline in both men and women. And then progesterone, also our mother hormone, and pregnenolone also start to decline in our mid-30s. The vaginal and vulvar tissue are very receptive to these hormones, as well as especially downstream hormones, testosterone and estrogen. So as we age and we start losing these hormones, these really rejuvenating hormones that keep our tissue. And we can see, like, if we age on I always use my hand. Am I hydrated today? Do I need some, what else? I need some more omegas in my system. My hormones adequate. I don't know. I look at my back of my hand at age almost 59 now, and I'm like, okay, this is my marker. Like, I got to keep my skin healthy, and especially down there. Anyway. So, but we look at it as a marker. We know as we age, we get these smile lines, laugh lines, and that's we can age rapidly and unhealthfully, or we can age healthfully. And so we want to really maintain healthy tissue integrity, especially for quality of life. The key thing is, as we lose these hormones on our vulvar and vaginal area, we get clitoral atrophy. And can have clitoral adhesions, which is very, very painful. Vaginal atrophy, so we say urogenital syndrome of menopause. It's vulvar and vaginal atrophy, so dryness. The mucosal thins out, the muscle layers thin out. We lose muscle and rugation. So instead of all these beautiful folds and glandular secretions, it becomes thin and atrophic and less flexible, less dynamic. And that can cause pain, discomfort, microabrasions and tears, and perimenopause tampon trauma from dryness. And that causes adhesions and creates a susceptibility to infection. And the pH changes as we age. So as women age, the pH of the vagina goes from acidic, 3.5 to 4.5, to more alkaline. So hence the fishy odor, the bacterial vaginosis, so that affects, and there's a shift in the microbiome of the vagina. This is so understudied. Yeah. This is so important, that the bacterial in the vagina is supposed to be predominantly lactobacillus species, predominantly lactobacillus crispatus. And, versus the gut microbiome, we want diversity. We want all kinds of bugs, like huge party, very multicultural inside our gut. In the vagina, no, we're very selective. We want lactobacillus and that's it. But as we age, it becomes more diverse. So you get all like Gardnerella species, and different types of infectious species as we age. So the more diversity in the vagina is not healthy. And that leads to an increases in infections, but also HPV. So now we see an increase in abnormal pap smears, and you don't want to be dealing with it in your 20s, let alone in your 60s, and an increase in cervical cancer. So we need to repopulate with healthy bacteria, healthy lactobacilli, and also create that environment where we're essentially producing our own natural acidic secretions from the glands. And that's through the hormonal or pro-hormonal use of DHEA and bioidentical hormones in the vulvar vaginal area. It's game changing. I've seen, it's really beautiful.
And I love how you're talking about a whole system, comprehensive approach, because this is so relevant. And there's so many different pieces to the puzzle that when it all comes together, it's perfect. And it really does work optimally. Our system knows exactly what to do to regenerate, replenish, and heal, and to stay as healthy as possible. But oftentimes there's so many disruptors. So I'm definitely thinking about that microbiome and how many things can disrupt the microbiome. And I think that's also another question I would have is how do you feel about vaginal suppository, like probiotics or the like suppositories that can replace that, as well as the pH changers for the temporary time that we're trying to rehabilitate the glands and
Yeah, definitely. Julva does help decrease the vaginal pH. So again, it's producing your natural secretions, and
yeah.
at the intrinsic level, it's converting
Mm.
to testosterone and estrogen. So you get that benefit.
Yeah.
And I love like vaginal probiotics. Like
Yeah.
there's Seed VSO1.
Mm-hmm.
That's a vaginal probiotic. It has been game changing in so many patients. And Microbiome Labs has their oral vaginal balance that it's their astartate mix with Lactobacillus crispatus,
Mm.
Einers, and Gasseri. So we see this nice blend, and you can take that orally also.
Yes.
And
I love that.
clinically has shown an improvement in the vaginal
Mhm.
decrease in the vaginal diversity into the
Yes.
Lactobacillus species.
That's brilliant. And so pairing that along with the Julva cream, that's like the perfect combination. Okay, so this now brings up another good segue into environmental toxins and hormone disruptors. This is something that we don't want to be fearful of all the things, but we have to be aware that there are so many things getting produced as chemicals and toxins that are just pervading our system. So we're absorbing it. We're, even through makeup and makeup removers. I actually was just watching some of your videos for some inspiration in this podcast. And I was so inspired because you had a video that had hundreds of thousands of views. And it's the video about making your own products. And in it, you were talking about makeup removers and how important something as simple as that is. But it's around us constantly. So what are some of the other things that women should be aware of that can disrupt just overall function in its hormone dysfunction as well as
Oh
microbiome
my gosh,
dysfunction?
there's so many. And yeah, the video you're talking about is my DIY lubricant video, which you can also, from those similar ingredients, make a great makeup remover, very clean. And so, yeah. And speaking of hormone disruptors, lubricants on the market are loaded with hormone disruptors. And I'm going to send you some, Leila. It's not on our, I've been working over the past couple of years on formulated a very clean lubricant. So it's now we have to get FDA approval because lubricants are considered medical devices, but it's with aloe vera, hyaluronic, and water-based. So it doesn't disturb the vaginal microbiome. And so it's a beautiful, clean combination without parabens, fragrances. I mean, artificial sweeteners. I mean, there's aspartame in some lubricants and parabens. I mean, it's really like disgusting. And because the vagina is so vascular, and especially as we get older, it's more fragile, that many of the lubricants can cause a lot of problems.
Yes.
And it just, again, we're worrying about what we're putting in our mouth, what we're putting on our skin. And so we don't want to skimp when it comes to playtime. If we need that extra lubrication for fun, it is so good, right? Because orgasm creates oxytocin, and we want it. I would say Julva for every day, Belvay, which is the name of my lubricant, for play. And so it's very, very clean. Anyway, I mean, that's important because oxytocin is the most healing hormone of our body, and we don't want any barriers to that. And what studies have shown, even in reproductive age without vaginal dryness, that lubricants increase enjoyment and frequency. The problem is many of the chemicals and everything that are in your standard lubricants are some of the most popular ones. Believe me, I've been in way too deep in the world of lubricants over the past couple of years. I mean, there's so much garbage out there. There are some really clean ones, but for the majority, it's hormone disruptors. And when we think about that, and especially anything around the vaginal area, vaginal washes, douches with perfumes, certain creams and chemicals, even prescription, for example, estrogen has very unhealthy, and hormone disrupting ingredients in there that can cause more problems. And certainly just from the topical can cause irritation, but also can, you're absorbing those parabens, and those are hormone disruptors. And so you want to avoid that, as well as there's, like food coloring in, there's aspartame. I mean, there's just
I can't even
so many
imagine.
crazy stuff. So yeah.
And people trust it because they see that the label says it's for this, so they just end up trusting it over the counter. And it's unhealthy for the women's toxic burden bucket as well as for the men's. So,
Absolutely.
and like you were saying, like whenever it comes to lubricant, it needs to be for the actual intimacy health as well as like making sure that it's orally safe. And many of those products and ingredients are not, because oftentimes playtime can have a lot to do with both. And so it's important that people are paying attention to whatever is going on their body anywhere.
Yeah.
That needs to be as toxic free as possible. But literally, if you wouldn't ingest this, then do not use this. That's
Right.
so
You're right.
important.
If you wouldn't ingest it, don't use it on on your body.
Yes.
And so with like the lubricant, the makeup remover, my makeup remover, it's like the same thing. Like I say for my lubricant, it's a good, and was DIY, and I produced this video several years ago, but it's half a liquid aloe vera, organic aloe vera, with half fractionated MCT oil, and you mix that up together, put a drop or two of essential oil that you like, and you have to shake it up because it separates, and use that you can use that. The issue is MCT oil as well as coconut oil, great lubricants, but chronic use, it's good for every once in a while, but chronic use can upset the natural vaginal microbiome. So you don't want to use that every day or too frequently. So that's the thing. That's why I didn't put any oil in my lubricant. So it's water based. But also, if you combine, just that combination of the aloe vera and the MCT oil, you can add a little bit more MCT oil. And if you have a small round container, the size of the cosmetic cotton rounds, you can put those cotton rounds in that container, and then you've got this great makeup pad remover. So you can use that for, all, for makeup and cleansing your skin, and same thing. So you have to watch, because sometimes the MCT oil, even though it's fractionated, if you're susceptible to clogged pores, but like I wear makeup on video days and not so much on any other day, but yeah, I would definitely be using that today.
And there are important sources of clean makeups, like organic, all natural, as pure as possible makeups. And making sure, even for eyelashes, I like to make sure that I'm using the kind that are like just the fiber where it just builds it. So it's not actually making the eyelashes get dried out, so that you keep your really long, beautiful, thick eyelashes.
Wait, tell me what that is.
Yeah.
What's the brand? What's the name?
Cosmetics. That's the one that I've been using, and I like it. It definitely really lengthens and brightens. And cosmetics is CAUSE, like cause. And so it's the more natural form. And I love how it doesn't dry out the eyelashes. And doshas, actually, Ayurvedic doshas can play a role. We have these 3 different doshas that can dictate how much our skin needs certain amounts of like hydration, or how dry we are just naturally as a tendency, and then how much we need to hydrate. So that plays a role in like how we put on our own oil on our face and our own hydration, but also for the vaginal region. I think it probably plays a role there too, right?
Yeah, absolutely. And it's the 3 doshas, Pitta, Kapha, and
Vata.
Vata. That's
Yes.
right. Vata,
Yeah.
I'm trying to remember. Yeah.
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 It's
So
interesting because it plays a role in hair, skin, and vaginal health. And it can also play a role in just like the fieriness of our nature and like the water, or like that sense of that flow. And so oftentimes whenever we get rigid and uptight, or that's just our personality, we receive information in from our experiences, and then the way we react or respond in our nervous system. Sometimes these doshas can actually have a way of describing like that tendency to respond in certain ways. Our pelvic floor can also tighten in certain responses, like our nervous system just stays more tight and isn't as relaxed and pliable and supple, and as much movement and flow in that health. And so we need to think about, how do we have healthy vaginal, pelvic floor, Kegel exercises, and how do we make sure that we have the healthy lattice work in the pelvic floor muscles to hold all of our organs exactly where we need them to be and hold the structure, but then also our nervous system to not be so rigid and uptight that we're getting that really strong sphincter response and tightening response.
right, being able to relax as well as tighten. And sometimes it's that we need more relaxation than we do tightening. But I
Mm-hmm.
love like talking about the pelvic floor, but really it's a pelvic bowl, right? Like,
Yes.
consider it as a pelvic bowl of muscles versus a floor.
I like
It's more
that.
of a hammock, but a real bowl if
Mhm.
we look at all our muscles
Yes.
within our pelvis, and they work together. And when I talk about doing a pelvic floor exercise, I always want my clients to think, okay, we're bringing everything together and up, like up
Yes.
through the vagina. And so in
Mhm.
teaching that concept, okay, what's the right way to do a pelvic floor exercise? Layla,
Yeah.
do you want me to teach that
Yes,
now?
please. We would
So,
love this. And we'll have a video on YouTube. So all the listeners who are listening to the podcast audio wise, refer to our YouTube video for this.
yeah. So if you think, okay, you've got this beautiful pelvic bowl of muscles, right? And so from clitoris, from around the clitoris, above and around the clitoris, to around the anus, behind and around the anus, and all laterally and through our ischial tuberosities and up through our pelvis, we've got these beautiful muscles. We
Yes.
think from clitoris to anus into the vagina. If you contract first, completely exhale, because you don't want to add pressure on the pelvic floor when you're doing a pelvic floor exercise. It's really counterintuitive because you want to inhale, hold your breath. Don't do it. Exhale, just relax on an exhale. And as you're exhaling, contract your muscles. So bringing them, clitoris, urethra, anus, all towards the vagina. Think of it that way, kind of bringing everything in and up, in, relaxing your abdomen muscles to the best of your ability. So you're not adding pressure to work on your pelvic floor. Relax, inhale, and relax. So that's kind of the contraction. Bring the muscles. So
Yes.
exhale completely, bring the muscles together and up. Hold for 3 seconds, up to 10 seconds. Inhale and relax. And relax completely.
Mm-hmm.
And so sometimes we're just holding so much tension in our pelvic floor that's a reason we have issues with incontinence or relaxation or orgasm. And doing things to release those muscles, to relax completely, to that can really also help with orgasm and sensation during play.
So important. And I love that you taught that conscious awareness and the mindfulness of what it's like to tense and then also relax at the same time, the muscles that we need relax, like in the abdomen and like with the breath. That actually brought some more awareness to that area. And it's good because there's so many ways that we often try to do Kegel exercises and we may not be doing them the right way or the most optimized way. So that's really helpful. And you have a video on Kegel exercises as well. So we can reference that. I'll make sure that I include that in the show notes so they can follow along with your entire video. That is so important. And so with these Kegel exercises, maybe we'll see if at the end of this podcast episode, if we have time, then we can go through like another little series of different types of exercises as well as the different ways of activating, because there are so many different muscles and so many different ways that we can increase the strength, the tone, and then the endurance. I think that's a really big important part is, having that endurance. For orgasm, it's so much more than just about the vagina and how the vagina is responding. It's about the neurological aspects, how the neurochemical, biochemical, the neurotransmitters are released, and how that balance of the hormones is all responding and reacting, and just the nervous system in general. How safe do we feel? Do we feel loved? Do we feel like we are honored? Like valued, truly intrinsically valued as a feminine, and as that divine feminine is our essence able to open up and open to the masculine in a way that we're able to be receiving of that love. And that's such an important component. And on our own, it's very important that women know you don't have to have the masculine to be able to achieve pleasure and orgasm, because that can also be very helpful and healthy for a woman to be able to, work with herself and understand more about herself and, the neural system of what this looks like. So with pleasure.
We have to know what brings us pleasure.
Yes.
Be able to voice what brings us pleasure and ask for it too. I think that's so important.
Yes.
I want to hit on one point too, because you're a chiropractor. I'm an osteopathic physician. So we trained in neuroanatomy and functional movement and and everything's related. And so when it
Yes.
comes to pelvic floor, those are pudendal nerves, sacral nerve 2, 3, and 4. They're
Yes.
the same nerves that innervate our feet and enable us to spread our toes. If you've ever been in yoga, they say, really
Mhm.
spread your toes. And so a way
Yeah.
to evaluate, for me as a physician, evaluating someone's pelvic floor health, their issues with orgasm, anything like that, or incontinence, I'll ask them, I'm like, okay, spread your toes, take off your shoes, spread your toes. Let me see, can you do that? And if you can't do that, there's an issue with the sacral nerves. It can be
Yeah.
just a matter of exercising those
Mhm.
muscles, or it can be that we need to do manipulation to
Yes.
increase that flexibility of the sacrum,
Mhm.
again, to release any pressure,
Yes.
contractures around the sacral nerves and the
Mm.
sacral nerve roots. So
Yes, I love that. I'm glad you brought that up. And that also, there are a couple of things that it can affect that. Like if ever someone's fallen on ice and hit their tailbone, or, just they're sitting as a job, as a career, they're sitting regularly and extensively, and it's not in the posture that is best for the biochemical or biomechanical health, or shoes, and how we cramp our feet into like very pointed shoes and very tight shoes that aren't allowing for that healthy toe spread and toe splay, especially as we're toeing off as we're walking. This is all so important and so relevant. And these can be things that are affecting that pelvic floor health and that pudendal nerve function and the sacral nerves. So it's very important to think about all these different levels.
it's all connected. It's all connected.
Absolutely all connected. Okay, so let's go to, I wanted to ask you about your opinion on this. I think it's very important that we are talking about the functional neurology of the orgasm, because in functional neurology, we know that all neuroplasticity, all nerves are connected in a way that whenever they're used, then there's a strengthening of that nervous system response. Well, same thing for a nervous system that's well regulated and in a relaxed state, in a peaceful state, in a harmonic state, or a more feminine state, and more open to receiving love or receiving pleasure, and just allowing ourselves to be open to pleasure, to allow the pleasure sense to occur. So these are two neurological components. And then the oxytocin is a very important neurotransmitter that helps us to feel that love, as well as just absolute all regeneration and healing and replenishment and longevity and anti-aging. Crucial, so important. So now, whenever we're thinking about orgasms, it's very important that women know if there is some tendency that they're not able to achieve orgasm, or they're not able to achieve multiple orgasms. Like they should be able to have endurance for that. And that's a neurological component, hormone component. There can definitely be some of these glands involved, and that affects how moist they're able to stay, or at least how much lubricant they're able to secrete on their own. And then they can have something external if they need that in addition. Or there's the other component of just, are they able to have that recycling effect that happens whenever they're releasing that huge amount of oxytocin, and then they come back into the waves? And are they able to ride those waves of multiple orgasms with the endurance? So all of these different components, I speak about to so many of the women in my practice, that this is very important that we're training this in. And then there are different ways that we can activate the neurology. So there's, of course, the insertion aspect. Many women do not orgasm just with that. And a lot of women do well with a combination of clitoral stimulation as well as penetration. And I think that so many women don't realize that they can state what they need and help them feel like it's okay for them to express what brings them the most pleasure, because neurology is different in each of these areas. And we have thousands more peripheral nerve endings in our clitoris than we do in the rest of our vagina, or especially in the inside of our vaginal region. And so I would open up the floor to you,
Yeah.
just sharing openly about like how important pleasure and orgasm and the neurological components and everything else is for this.
Yeah, this is so important. And it's important to talk
Mhm.
about because we often don't realize it. There's a couple key points I want to make is that women need to understand, especially if they're in their relationship with a man, is that his pleasure is your pleasure. Your
Yes.
pleasure is his pleasure. Like he wants you to be happy. So
Mhm.
like always say, start by learning what brings you pleasure.
Yes.
Start by expressing what brings you pleasure. And you can
Mhm.
start with like, it brings me great pleasure when you do a load of laundry before, I don't know, before Sunday or whatever it is. That really brings me pleasure. It brings me a lot of pleasure when you take out the trash. I mean, whatever, you start outside the bedroom and then inside the bedroom, it brings me pleasure, because oftentimes there's something that you think is that he likes to do. For example, nipple stimulation, for instance. This is a conversation I had with a patient, and she was like, I don't have much libido, and I was asking her, well, are you good once you get started? She goes, yes, once we get started, I'm into it. And that's secondary desire, and that's very normal. So secondary desire is very normal. But then she goes, then I'm turned off because he does, he likes to play with my breast and my nipples, and they're sensitive and I don't like it. And I said, well, she's been married 15 years. And I said, well, have you told him? She said, no, because he likes it. I'm like, I guarantee you, you need to have this conversation so you can enjoy it, because he thinks it's bringing you pleasure. Right. And if it's not, guide him to what is bringing you pleasure. Yeah. And that's really important to own into what makes us feel good, what brings us pleasure, to be open, to explore and to play. And so there's that huge component. The second piece of that is, if the upper lips aren't talking, neither are the lower lips, right? Yes. So communication is key. And in my sexual CPR program, I say, well, as physicians in CPR, there are the ABCs, airway, breathing, circulation, right? In sexual CPR, there are the ABCs as well. So A is accept where you are now, accept accept how you look, accept how you feel, accept yourself, because I guarantee you, for men, they look at what they like. And we're reflecting, I don't want him to look at me this way because maybe I have more wrinkles or, whatever. I don't like this part of my anatomy. Get over yourself, right? Own it, accept how you are fully, accept where you are, and just see how that shifts. And the second B is be present, because we can be doing to-do list, carpool list, grocery list, thinking about work. I don't know. Is it anyone else or just me? But, we can be not present. And the key thing is to be present in our body. And in that, the concept of sensate focus was very popularly developed, being aware of your senses, being tuned into the touch, because what we expand on grows. Yes. And so then being able to voice, I like this, slow down, this speed, touch here, and really guiding is very positively received by our partner. And it also enhances your focus and your pleasure. And so that being present with sensate focus is so key. Yes. So key. You have to be in your body for orgasm. And C is communication, for sure. Communication. What is, and very positive, because there is no man or woman, how gorgeous, how successful, how wealthy, how buff, whatever the situation may be, that is vulnerable in any area of their life, more so than when it comes to their sexuality. Sure. So we are incredibly vulnerable sexuality, and sometimes something that was said years ago can still be holding on to us and creating a barrier to pleasure and enjoyment and acceptance of our orgasm and being able to be in tune with it. So those are the ABCs. And then another important thing, if we're cycling, to remember that at certain times of the month, the clitoris may be more sensitive or the cervix may be more sensitive. And so getting into tune with your own cycle and your own desire and your own patterns of sexual impulsivity, because that's going to vary with your hormones. Yes. And postmenopausally, we want to create that with our brain, with our mind, with our thoughts, with embodiment, with seeking pleasure. Yes. And to be really present with that. And with all of these aspects, we increase, and with positive touch and play and pleasure, we increase oxytocin. It is the most, for me, that's the queen of all hormones. That is the most powerful hormone in our body. It is, neuroregenerative. It is, supports our immune system. We use oxytocin I do in my long COVID protocols when needed, to help with orgasm if needed, to deal with PTSD. But oxytocin is that age reversal hormone, to really be honest. It really is. It is that hormone of longevity. and as is the most alkalinizing hormone in our body. Do something fun, guarantee you, check that urine pH. It's going to be more alkaline. So, my work, I'm obsessed about people checking their urine pH. So, this is the importance of oxytocin, creating that pleasure, creating that play, and removing barriers to it. Because, whether you're in your 20s or your 70s or 80s, that is open and available to us. We have to remove the barriers to it.
Yes.
And, certainly vaginal dryness, and those are unnecessary barriers. So.
Yes. Wow, that is so helpful. I love that ABCs of the CPR approach to bringing back that very healthy and just fulfilled way of interacting with a partner and interacting with yourself. Because in doing so, in that communication, you're honoring yourself enough to speak up and to speak your truth and to allow for your authenticity to shine through. And that's bringing that self-worth, that self-love, that self-respect. And that's something that so many women, I think, need to really make sure that they're loving themselves first and foremost. And then it's so easy for their partner to just pour that love right back in, because that fills up that bucket, and it's this constant just in their energy field. You can feel it. You just are emanating that beautiful love from the inside out. And oxytocin definitely helps to amplify that. And coming down to the foundation, especially if that's how we're now releasing more oxytocin, and is because we've had our self-respect enough to step forward into maybe a stronger way of expressing ourselves in our relationship. That is so powerful. I love that you're bringing that up. So whenever it comes to orgasms, there are endurance aspects that play a role in multiple orgasms. And I think that this is an important component, because so many women, we talk about sexual health every time that we're doing a functional medicine visit and functional neurology, just because this is a foundation. And I think it's so important. And so many women will say they're lucky if they do get one orgasm during intercourse, and then to have multiple. By the time that they start having one or two, then they seem to wear out, or they're very shortened orgasms. And so they'll just only peak for a quick 10 to 20 seconds. So in endurance, is that something that pelvic bowl exercises can help with? And these Kegels, these upgraded Kegel exercises, can help to strengthen for endurance after people do them for, up to 2 or 3 months to really optimize the function.
Well, I definitely want to hear about your insight into this too. And so certainly in my work, not only the pelvic strength, because muscles increase, healthy blood flow, healthy nerve supply, sensation, and stimulation. So that's really important versus numbness. And I hear from many clients, my clitoris is numb now, or, I'm having problems. And I would say 10 to 20 seconds of climax, that's a good climax though. 10 to 20 seconds, that's a healthy climax. And you can, again, like anything, there's a discipline and a practice to go into rolling climaxes. And that is through relaxation versus often tightening. And so the key thing is to relax into that. And breath work is a really big part of that. What does breath work do? It stimulates the vagus nerve, stimulates the pineal gland, stimulates oxytocin production. And so that can be a really important component, that relaxation, but also sometimes it's that sensate focus and awareness. In regenerative sexual medicine, there's things we do with PRP, for example, with the G-spot injection. And this brings me a client that I had who was 35 years old, and she'd never had an orgasm. She never experienced an orgasm during sex with her husband, never experienced an orgasm on her own. And she'd been on SSRIs a long time. So there were a lot of issues. So we worked on working essentially my very holistic keto alkaline method, my keto green approach, diet, nutrition, try to improve neurotransmitter and hormonal function, certainly. But I did a G-spot injection for her so she could have sensate focus. So worked with, instructing her husband to be able to identify the G-spot, her to be able to feel that G-spot. And initially she was just numb to it. She couldn't tell any part of her vagina from another. And so there was that identification. So I injected the G-spot with, at that point, it was just hyaluronic, and now I mixed with PRP. But hyaluronic into the G-spot. So she had this ability to have this sense of focus and area of concentration. And so I remember, like, a couple of nights later, I get this 3 a.m. page from my practice, and it's my client, and she's like, I don't know what happened. We were having sex and it was great and I felt amazing, and my uterus started contracting and you're like, I don't know what's happening. I'm like, okay, that's a pelvic orgasm. That's amazing. And so it was the first time in her life that she had experienced it. And it's just that awareness. Our body is orgasmic, and it's able to, it is challenging. It's not easy for me. It is like, okay, mind, get out of my to-do list, get into my body. All of these things have to, like, it's like the stars have to align like a solar eclipse sometimes. It can feel that way, but the more you relax into it, practice and focus and play, that is where you really open up these sexual, energetic pathways that are they're spiritual experiences.
Yes, they are. Wow, I love that you mentioned that. That's exactly what I feel like it's the greatest amount of inspiration, especially like our own soul wisdom, who we are. We oftentimes get so scattered just living our everyday life, and we oftentimes have dispersed our energy so much to so many different activities. And if we can just pull it back in, center ourselves, and then ground and connect in a way to our greatest version of ourselves, our highest version of ourselves, and then allow for that wonderful, powerful, deep soul wisdom to come through, that's when we can be so inspired to walk forward in an empowered way, knowing that this is our path and we're truly paving the way authentically without walking in a scattered way or being in the passenger seat of our lives that we so often are. It's like we can actually take that power back and really make sure that we are moving intentionally through life every moment of every day. And to me, I think that the orgasm, that feminine orgasm, is the greatest ability to connect with our soul, with who we are truly and intrinsically. So I think it's so important. And from a functional neurology standpoint, there are many ways. I love that you mentioned breath work, because that is a huge component. And I do teach a way of doing like an upgraded functional neurology of the orgasm foundation to just help women to get back in tune with really creating the proper pH balance through breath work as well, and the centering, because breath work can embody who we are more authentically whenever we just do like 2 or 3 rounds worth of an intentional breathwork pattern. Then what that can do is that helps to shift pH balancing while we're, maybe going into a longer breath hold. If we go to 90 seconds to 2 minutes worth of an exhaled hold, then we're going into this higher state of this hypercapnia and like these, just the way that we're rebalancing the carbon dioxide to the oxygen. And then whenever we take back in the inhale and we're holding on to inhale, there's a difference in the balancing effect that happens. So pH is one component. The other aspect is because we're being so intentional and we're holding ourselves in that pattern of that breath work. And if we can do this every day, every morning, along with like pelvic floor, pelvic bowl exercise and strengthening, that really helps to balance the way that the nervous system is able to go into cycles of the tension versus the relaxation. And the breath work comes second nature then during the intercourse or during the intimacy. It can be something that then whenever you're in the middle of the cycles, you do like a little breathwork sequence, just that's a natural response anyway. But then whenever that breath hold happens, that's whenever it allows for us to really anchor our nervous system's energy down into like the dantian or like our sacral chakra area, like right below our umbilicus. And that's where it just centers so much chi energy. It's like we have, all these acupuncture meridians that we talk about in traditional Chinese medicine, and then chakra energy and energy bodies, and how our system is expressing itself in an electromagnetic field that centers and anchors in to bring all of that energy down into the pelvic bowl, so that when we do like release into the orgasm, then it's like a launch, we're able to just like launch ourselves and our own consciousness into a significantly higher plane. Like it's almost multidimensional. I think it's the way that we get these kinds of functional neurology stimulations and activations and just upgrades in general. It's like an evolution of the nervous system right then in those moments. And then, the breath work, I think that that's an important component to know how after an orgasm and between orgasms to allow like that 90 seconds to 2 minutes of the recovery period or the relaxation period to then peak into another and then to keep riding the waves. It's in the breath that we have that power and that control to synchronize with our own energetic wave patterns, because it can rebuild if we've been practicing regular breath work on our own outside of intimacy just in the mornings. Then that's a natural thing that we've gotten that response trained in the nervous system and in the pelvic bowl muscles so that we're able to ride those waves.
Okay, you're going to have to walk us through this breath work. We all want to do this breath work right now. So
let's do it. I'll do a just like super general one, and then I could film this on my own. Actually, since I have you on, let's have you teach your Kegel muscle exercises, and then I can film afterwards the little bonus for how to do this breath work and the exercises, because I want to make sure that we get all this in. It's so good.
Just consistently doing that contraction, and usually just try to do 3 to 10, hold for 3 to 10 seconds, and at least 3 to 5 times a week to really be able to focus on the pelvic floor, and just always thinking, okay, we've got this beautiful pelvic bowl from, clitoris to anus, and bringing that together up and in.
Yes.
And working to really focus on those muscles. So we're relaxing the other muscles and we're giving them time and attention. That helps all the vaginal muscles.
Yes.
And then being able to relax fully and completely.
Yeah. So important. Okay. And then adding to that, this is a perfect segue into pairing that exercise, that Kegel work, with breath work. And simply, I would follow like a 10-minute segment of breath work in the mornings. And I like the idea of 10 minutes because that's a good amount of time. Like if you're able to, practice this kind of breath work over the course of several months, your body and your nervous system gets to the point that you can also ride the peaks of the orgasms for endurance. And it can be for 10 minutes or more, just you're training for the 10 minutes, at least at a minimum. And so then whenever you are synchronizing this, it's the breathwork pattern. I like to use a Wim Hof style breathwork. And so it's the short, quick bursts of air. It's about a second in and a second out, in through your nose, out through your mouth. And I do a series of about 25 breaths. And then at the end of that 25, then release into an exhale. And that's when we're also doing the Kegel exercises. So strengthening and lifting in a way that just allows it to stay tight for as long of a hold as we're able to handle. Usually we want to aim for at least 20 seconds in that hold. If you're able to, you'll work your way up. So every single time that you're doing this breath work, you'll notice that you're getting longer and longer with your Kegel hold. Then you release down, let it relax, and then just be in that centered state in at least 30 seconds worth of total relaxation. Then you'll already start feeling the need that you may want to breathe in. But if you can ideally get to 90 seconds minimum of that exhaled breath hold, lifting into the Kegels every 30 seconds, holding for about 10 to 20 seconds, then that's where you're training that endurance. And then do release out of that exhaled hold. Inhale and stay at the inhale for 30 seconds. Again, do the Kegel work for just a small little tightening around if you need to, like just feel what that feels like, the difference. Releasing out. And then you do that pattern 3 times. And that's one of my favorite ones for just a very general every single day. The one thing that we can add in is called fire breath. And that's one that we're actually training different levels of really strong chi energy to synchronize into certain areas. And the first 2 areas that you focus on with these rounds is the Dantian region right below the umbilicus and then in the pelvic bowl. And so that brings that energy down. And then the third place that you focus in the third round is right at your forehead, right at the pineal gland. And in those areas where significant amounts of oxytocin are releasing. The fire breath, the only difference between that and Wim Hof is that it's a very short, almost half a second in, half a second out. And you're also like squeezing your hands and moving your spine so that you're getting this beautiful wave pattern. And that's pumping the cerebral spinal fluid. And that allows for that huge release of Kundalini energy up into the pineal gland, into the brain, and also really helps to heal and, strengthen where the body, the brain, and the nervous system are all stimulating that wonderful, the secretions of the spirit secretion is kind of what that CSF flow is called. It's because it has so much essence for our nervous system balance. So I'll make sure that I include in the show notes a little video about this, as well as the links to Dr. Anna's videos, because they are so helpful. So you can do her Kegel exercises that she's recommending, along with pairing it with this breath work. And, Dr. Anna, we should definitely film and record a full session of this that we can both share into our YouTube channels. And so let's do this.
Definitely. We'll have to get in person. We'll do it.
That
for sure.
Good. Let's do it.
Yeah. Thank you.
So
Thank you. Yeah. And the
show.
fire breath orgasm by Barbara Corrales was the first one that I heard training that actually include that as a segment in sexual CPR, but that concept of that fire breath orgasm and that bringing that in. I like the concept of the undulation so that you're moving the spine and really working to move that spinal fluid up to stimulate the pineal gland for that, the vibratory stimulation and release of oxytocin. So all right, good.
Okay, so we're going to do another segment that's the how-to version of this, and we'll make sure to include this when we release this episode. Thank you so much, Dr. Anna, for joining us. We're so grateful, and please tune in to the Resonant Life podcast on the next episode.